Great. Good morning to everybody who tuned in, and I hope you're going to find it quite worthwhile. I would also quite prepare if there's any practical advice or learning that we get from this. As when we started, we were saying it's an unprecedented event. It's one of the greatest disasters of our time that we're busy dealing with it, and to deal with this type of disaster, there's no handbook for telling us how to do it. So we're finding a way as we practically deal with it. Luckily, there's a lot of sharing of information these days on the internet and goodwill amongst countries. Let's start with what happened in South Africa. In December, when we heard about the COVID-19 diseases in Wuhan, China, it sounded very far, and it will never affect us. The only time that it started really getting home to us is there was quite a lot of South Africans in Wuhan that either work there or study there, and the government were trying to get them back. And when we start seeing this in the media, it starts getting a bit more real that we will also be affected. Then in March, we start having our first cases, and our president, I think we're fortunate to have such a forward-thinking president like President Ramaphosa, declared a state of disaster on the 15th of March. And also after that followed, because we're quite the international hub and a lot of traveling that's taking place to our country, it also started with international travel restrictions on the 18th of March. Then I think very, very quickly, and we've learned from other countries, the president instituted a national lockdown, a very hard lockdown, on the 27th of March. And initially it was for 21 days. It was further extended because the president has got a lot of consultation with all the health institutions, the epidemiological institutions, with business and industry, really doing a very, very good job. As I say, we're so proud of him. And then after extension to 30th of April, and we will then see as the caseload progress what have to happen next. To enforce this, they use the Disaster Management Act to gazette certain regulations. And as I said, it's a hard lockdown. It's only essential service to continue, and it's services like the police, travel, energy services, health services, obviously then services like waste management services, and you've got access to basic food and stuff. What was very interesting, people were very happy with that. The only thing that they're not very happy with is that at this stage you can't buy no liquor and you can buy no cigarettes. So it's actually a very healthy time in South Africa now. I think the guys who like the liquor and the smokers would kill me for this, but okay, this is just the lighter side of it. And then we realized that there's a big financial impact of this pandemic, and it's really going to plague us for years to come. Our country were already at economic slump, and this is really havoc. But our president has put our lives upon the economy, and which we're so happy about. Thank you.
Okay, thank you. So, what is the significance in this scenario of waste management? And what are the risks and challenges faced in this in the light of the pandemic?
Great. Now, waste management is an essential services, and it's really very important to contain the spread and the management of the coronavirus. And they say that waste personnel comes second in line just after the health personnel. We know, like a lot of overseas countries, I specifically want to mention the UK has given a lot of additional benefits to their waste workers to make it for them possible and to look after their families during this time. And I know that the international global organization ISWA is also supporting it and trying to advocate it that other countries will do the same. Now, effective waste management is crucial, as I mentioned it, and it's very, very important that it goes on and all the areas are basically serviced. So this initially, when this lockdown started, people were unsure how should it proceed, and initially we had to get that fear going and say that business as usual, but obviously we had the added risk now of this waste from the COVID-19 pandemic. Firstly, for the first time, we were forced also to take our staff as also seen as essential workers, and we had to work from home. So we were not prepared for that at all. So we quickly had to get designations. Otherwise, our staff can't travel around should they be required them to travel. And setting up the infrastructure to work from home, make sure that everybody has got access to the internet and has got the necessary equipment. And then make sure that we got good, clear lines of communication and coordination. And that was quite an effort. Then we also had to protect our workers and the waste workers. And this is quite an important task. And we also in South Africa have a lot of informal salvages or waste pickers, depending on where you are in the world. Depends on what they're being called. There's about between 60 and 80,000 in South Africa, and they play quite a crucial role. And in the other provinces, they are responsible for the biggest part of the recycling of recyclables. In the Western Cape, it's a little bit different. So they're quite important, but because of the infection risk, unfortunately, they can't function. And then there's the waste workers. So we had to identify, do risk assessments, and to protect them. But what is found, because the whole world is basically plagued by this disease, suddenly the availability of personal protective equipment becomes a big problem. And we really, really had to do a lot of things to make sure that our waste workers and our also staff has got access to that. And I know the national government has done great work here, and they started with bulk purchasing of this equipment. And at this stage, I can say all the waste workers in the Western Cape has got access to appropriate personal protective equipment, which we're so happy. Then to deal with the waste, because we had to learn a little bit about this animal, the coronavirus. We have to look at the infection risk, and obviously, because it's seen as healthcare risk waste, it comes at a pretty penny, the cost of removing it. And because we're already in a financially constrained situation, we had to do risk assessments, and in the risk assessments, we tried to find practical ways and more affordable ways in dealing with. Obviously, it didn't cut corners at all. And then a big problem that we find is actually in South Africa, the confidentiality of patients in the health department is really seen as very, very important. And also the stigmatization that these persons would have if it's get known is making it very difficult for us. So it's much easier if you could identify the households that's affected by the COVID-19 pandemic, and you can isolate and work on them, and you have got certain specific measures that you're dealing with them. But now it was very difficult. So we're trying very hard, and sometimes in this, they got joint operational centers in the province and also in the local municipalities. And in some of these joint operation centers, they share the information, but only to certain people, and make it easy for the waste managers to actually handle basically this affected households. Then also we quickly had to do the assessment of treatment and disposal capacity. And we're fortunate in the Western Cape that at this stage, I think we've got enough capacity for this phase of the pandemic. We know that we're entering now the second stage in the pandemic. This is where you've got 90 and more new cases per day. And then from what we've seen around the world, then your caseload is growing exponentially. And as I said, we monitor that very closely. We got our law enforcement people also checking with the people and make sure that no corners are cut and it's done appropriately. Thank you.
So I'm sure all governments are being tasked with challenging decisions at the moment. So in South Africa, what are the guidelines that have been introduced in Western Cape to deal with the current situation, which includes, of course, residential and medical waste? And especially with household waste, I think there are various risks, as there may be a household that's affected, or someone might have some symptoms like cold, cough, and workers are dealing with hazardous as well as infectious waste. So what are some of the guidelines and preventive measures that you might have introduced there?
Thank you. We luckily got a very good working relationship between the different spheres of government in South Africa, and also between, as I said, we got 3 spheres of government: national, provincial, and local. And it means that all these spheres of government has got executive powers, can have bylaws and regulations and acts. And then we got a very good relationship between the National Department of Environmental Affairs. I work for a provincial department, and we started liaising. We're also liaising with other countries I got very good liaison with other countries, specifically Italy. We looked at what are happening in the US, the UK. We looked at certain institutions and associations to find out what they've learned. And out of that, sort of, we started with shaping what we need for South Africa. And we then start with the development of waste management guidelines for the Western Cape. What we did is the Department of Health nationally, they moved quite quickly, and they produce guidelines that deal with basically hospitals and also with health facilities. And what we've seen as the pandemic progressed, we had to start doing a lot of community testing now. And now to care for the next caseload of the exponential growth in this pandemic, they're starting now with isolation and quarantine facilities. And that's different from hospitals. We had to do risk assessment, and in the process of developing a guideline, just before the webinar started, we were actually finalizing it. And our healthcare waste from these areas will be handled. And then we also got very good legislation in the Western Cape on healthcare risk waste. We got an act and also regulations. We'll just go to my next slide. Then, as I said, a no-brainer is that you must ensure that your waste collection is continuously going ahead. And what we did is we started looking at as I said, how long does this virus actually lives outside of a human host. The one that I've shared here come from the New England Journal, and there's several of them. And we also, as I said, touch base at this stage on the information available on the ISWA website. And you could see, like they were saying, it can live for 3 hours in the air, 2 to 3 days on stainless steel, and then polypropylene plastics, about 3 days. So what we did, and we then decided that we're going to build in, going to be a precautionary approach here, and we build in 5 days. And then we were quite confident that if you keep this waste in a certain way for 5 days in the sun, that it would actually kill this virus. Then, specifically with household waste with COVID cases, we stressed in a protocol which we sent out to all the municipalities that they must designate, and we gave them advice on how to designate essential workers, and that waste is disposed securely in disposable plastic bags. Initially, we were of the opinion that it should be in a different color bag, but because of the stigmatization, we decided against that. Because when we've heard that in one of our townships here in the Western Cape, the first positive case that they have there, the landlord immediately evicted the lady, and we want to avoid things like that. So then when the bag is full, it should be placed in a second bin liner, and it's stored separately for 5 days. It means then that if you set it out and there's still weekly collections, that if this bag hasn't stayed for 5 days in the sun, you do it at the next collection, and it's been done by the municipality, and there is good awareness and training with these cases and houses and hotspots that will be dealt with. We started getting an agreement. I earlier mentioned that we had a problem in identifying the specific households. After lots of discussions with the Department of Health, they agreed that they're going to give us polygon information. We will start getting polygon information from tomorrow, where it'll be easier to identify the effective wards and hotspots and also households. That will make it easier. What we also said in this protocol, no separation at source at the affected households. And we capacitate the households on disposal practice. And then we made them aware of the risk associated with the COVID-19, and that they should have appropriate personal protector. Great.
Okay. We have a question here from one of the attendees. Now, he wants to know, how are the recycling initiatives affected by the pandemic?
It's definitely have a big impact on that. So what we had to do, we closed all our recycling and material recovery facilities and also transfer stations to the public. So at this stage, if they got an official system that's running, like in the area where I stay, that do continue until we identify that this is a hotspot, then it's not taking place. But in the areas that not affected, that got gone ahead. But as I said, in the big part in South Africa, the people rely actually on the informal salvages or waste pickers that has stopped. So I know the city of Cape Town had advised their residents actually in the area where they don't have, say, a 2-bag or a 2-bin system, that they should stockpile basically the recyclables. But if they then set it out with the normal black bags at these material recovery facilities, that will be actually then separated and recovered for recycling. But that have a big impact on this industry.
Right. So, could you tell us about the specific health and safety measures that are in place for the waste workers as they're working on the front lines?
Yeah. As I said, they also frontline staff, and it's so crucial that we do protect it. And they very, very strict hygiene principles and norms, and the frequently cleaning and changing of the PPE, person protective equipment, is non-negotiable. And then the basic PPEs such as gloves, mask, and overall, and a lot of municipalities they are using disposable overalls, is a must. And then very, very important, it must be cleaned and changed daily, and they must also be taught how the PPE should be worn. They say it's terrible if you wear PPE, especially where you got a biohazard. And when you start taking off the PPE, sometimes the biggest risk is actually in contaminating yourself. So this is very important that there's practical sessions and they know exactly how to deal with that. And then, like in the rest of South Africa, social distancing is very, very important, and it must be applied at all the places of work and in change room. And then absolute no-no is direct contact without gloves, with bins and bags. Then also, there have to be disinfectors and hand sanitizers in each of the vehicles and at each of these facilities, that they can practice good hand hygiene. And as I mentioning on the disinfectants, frequent hand washing and increasing cleaning in the workers' facilities is a must. They also, the sanitizing and disinfectants of the vehicles and the equipment and some of the facilities are also very important. I haven't touched a lot actually on the cleansing part, but the municipalities are doing a lot of cleansing and decontamination of facilities and public open spaces also. And help them. And in that case, you should also protect your workers. One thing that you should not forget, remember the older people, the immunocompromised people are at a big risk. And it's also important that if you've got very older workers and you've got people with immunocompromised systems, that you would also maybe not put them in the front line.
Right. So you were just, when you were talking about the PPEs, I have a question. Now, is there, because, there is lack of equipment as well, because the whole world is now looking at how to deal with the required PPEs. Now, is there any place where they might reuse this equipment, like gloves or, because during the day they have to work in shifts throughout the day. So how do you deal with that?
Yeah, it depends on what type of equipment you have. If they've gone for disposable equipment that's being as I said, this is being disposed. If it's then equipment that can be washed and be reused, they do that, and that's obviously there is guidelines on how it should be sanitized and how it should be handled. Because as you rightly say, the whole world is struggling with PPE, and it's a constant, how can I say, thread that you have to make sure that everybody who should have it have the right PPE. So this is a very important part of the, if it's not disposable, that you can clean it and clean it at the place where it can be properly cleaned without cross-contamination of the staff.
Right. I think you touched upon this, but someone is asking as to whether there is a separate collection system for infected households. Once you're aware that there is a household that's affected.
At this stage, not. There's not, because we obviously that add cost and equipment and logistical nightmares. What we hope, when we start getting the polygon information now, maybe we'll start using a certain truck just in that specific areas. But at this stage, I think we're now in the Western Cape at 676 cases. We had 7 deaths, and any death is too much. And then the biggest eye of the infection is actually in the city of Cape Town. So they actually the more urban area. And I think they has got a bit of a problem in sorting that out. But in the rest of the province, it's sort of widely distributed, and it's much easier to do that. I think one will have to start looking as the caseload exponentially increase in the city of Cape Town to do something about that. But at this stage, not separate collections at this stage, because it's after this bag is 5 days in the sun, it's been taken. And in most cases, they build in an extra bit of extra time with the bags at maybe at transfer stations, and that's been taken normally to landfills for disposal. And that brings the cost down dramatically, because remember, this cost would be for the household.
Yes. So there's a question related to that. You're keeping the bags in the sun. Someone would like to know as to why there is a need to keep these bags in the sun for a few days.
It is because this novel coronavirus is sensitive towards temperature. I think we're quite happy at this stage, and I think Africa is happy in this stage. One of the factors that it hasn't such big case loads is because we're in summer. We're changing on now to winter. So the hotter it actually is, the easier you're actually killing this virus. And that's why we're trying to do that.
Okay. So one of the attendees would also like to know whether other governorates also are following similar monitoring patterns like in Western Cape.
Unfortunately, I can't tell you at this stage. My head is so down in solving the things in the Western Cape that I haven't communicated actually to find that out. But I promise to find that. I assume it will, because we all work under the Disaster Management Act. And in the Disaster Management Act, it requires that there is a provincial sort of a joint operational center, and that there is district operational centers, and also that at local municipalities at operational centers. And I think those operational centers will focus on all the aspects, and I assume that my colleagues will be dealing with that. If I say anything other, I will be lying, because I haven't checked that, as I said, but this is a point that I will check out with our National Department of Environmental Affairs and hear if they're aware of something like that. And I think it's also maybe something good that we can maybe start sharing with what we're doing here, although we share it with the National Department, but that we know who is operating in which of the provinces, and then also maybe have a regular check-in with them and see if we can learn from one another, and don't sort of, how can I say, every time have to develop the wheel again.
Right. Okay. Of course, when communities are involved and the scale is so large, awareness becomes key. And there are many awareness and coordination issues related to proper waste collection, disposal, as well as treatment. Now, what are some of the measures or initiatives you have in place to help improve efficiencies?
Okay, yeah, very, very important. You have to get the community on your side, and remember, people are very, very scared at this stage. As I said, in South Africa, you can only go to the shops to buy basic sort of commodities. And when you go to these shops, people are so scared, they don't even greet you. If you walk down an aisle, they're basically like, they're not running, but they move away quickly. So you have to allay their fears, and at least that they trust the government that we are competent and that we will protect them. So what we've done is we've started with a lot of community awareness, and we start sharing information, like the one with the bins, making people aware of how many hands touch that bins. They say during the day, one person on a waste truck touch about more than 1,000 of these handles, and so you have to be very careful. Then we also started sharing information, because everybody wants now masks, and not all masks are equal. And just to make sure that they can make an informed decision, should they want to use a certain mask, what is the efficiency rate of it. And then we also requested all the district municipalities and the local municipalities to work with us. The province has got dedicated marketing teams that share everything about the disease, about the caseloads, what you have to do, the basic principles of can I ensure that you don't get the disease. And then I've used an example of the Garden Route municipality. I know we're fortunate in the Western Cape, we got 30 municipalities in this province. And one is the city of Cape Town, the metro. The bulk of the people is staying here. We got 5 district municipalities, and we got 25 local municipalities. The local municipalities operate within these district municipalities. And at this stage, everyone is pulling their part. But I think at this stage, I want to use this as a best practice, what's happening in the Garden Route municipality. They got this fantastic coordination between the disaster management personnel, the Department of Health, the environmental health services in the Garden Route district municipality, and the waste managers and of local municipalities. And they initially, when it started out, they were quick out of the blocks. And there was just an example on what they share. You can actually get it online also if you Google that. And then they, in a very practical way, they would spell it out to the residents on how it should be handled. But very, very important, because people are scared, and you have to make sure that if they work with you, it's a lot less logistical problems that you have. And at least you know that things are happening quite regularly and as it should be.
Right. So talking of disposal and treatment, what about the capacities? Is there enough capacity to dispose of the healthcare as well as household waste, including the COVID-19 waste? And what kind of treatment capacity exists there?
Yeah, unfortunately, I should have had you the treatment capacity, but I don't have on the tip of my tongue. But we did do the risk assessment, and as I don't know if I mentioned, but we got 2 incinerators, one in the Cape Town area and one in the Southern Cape area. If you know South Africa, beautiful. You must come and see it. It's, they say, really the Garden of Eden in that area. So please, once these limitations lift, come to our country. We need the gas injection. Come and see us. We'll show you. And then we got also an autoclave, and we put certain requirements in the autoclave, and it can be used for that also. And then we got the electrothermal deactivation plant that can also do that. We also planned for the eventualities now with the exponential growth that we're expecting. Suddenly we have to start looking at the capacities to bury people, the crematoria. We hope we're never going to use more than what we have. And what we also started using as a plan B. So once these thermal and non-thermal technologies, and we also check that around the world, and also in line with what ISWA is eco-recommending, that it can be used. And as a plan B, we will start going to our high hazardous sites in South Africa, but that will only, we go there once we run out of our space at appropriate and license, and we strictly monitor that treatment facilities. And once we, as I said, I hope you're never going to get there, but if we get there, we'll start going to the Class B sites, and we'll use the terms of disposal that's recommended by ISWA. And if we still overrun in that case, then our last option at that stage to start looking at the cement kilns that can do the appropriate sort of thing in disposing of the waste. So we've got a couple of plans in place, and we really hope they'll never get there. You see, what has happened, that because the economy closed down, is there's more people at home, but a lot of the sectors is not working at all. So that's a reduction in waste. There's definitely an increase in healthcare risk waste. That's definitely the case. But there was not an increase in waste in total, because the biggest portion of our economy is actually locked down. So that make it a little bit easier to handle, say, the general waste types. But we got in this stage enough capacity, and we've planned for eventuality should as the exponential growth in the pandemic. I think the forecasters say that. Yeah,
right.
Sorry. Correct.
So, related to what you just said, I think there's a question about volumes of waste, whether it was increasing because of the lockdown. So I think you just answered that.
Yes.
So who is involved in the monitoring of these waste bags, contaminated waste bags being kept in the sun for 5 days and following the procedures exactly?
That we've left to the municipalities. They work closely with the environmental health practitioners, and they play a monitoring role in doing that, and also ensuring that the communities know exactly. As I said, we had a bit of a problem in isolating these cases specifically, but it's improving and it's better in certain regions. And we hope then from tomorrow on, we will have polygon information that make it quite easy, because we can get special attention to those specific areas there. But as a safeguard, they build in as a safeguard that once they pick it up from the households, it stays another 5 days at transfer stations before they take it. So we actually built another 100% safeguard into it.
Right. So that takes care of people living in of the waste that's coming from the apartments, townships, and other informal settlements, right?
Yes, yeah. We had a bit of a problems in adapting it for the informal settlements, and we had to start with special, how can I say, arrangements in those areas. But it's very individualized. So depending on the type of system that they have in a township, they would adapt it towards that to make sure that they build in that safeguard. But as I said, we tried. But once the waste is taken out from the communities, it's also taking to be stand over for at least another 5 days before it's actually taken to landfill, just to make sure that that's also being done and the virus is being killed.
Okay. Someone here would like to know, as with regard to the slide, now we're talking about the mask protection. So they would like to know as to whether it refers to the person that's wearing the mask or the people around the person.
This is to the person wearing the mask.
Right. Okay.
Now we try to reserve the first two masks, the N95 and the surgical mask, for the healthcare workers, and from there on the FFP1 mask. From there on, we started to get that to our waste workers, because you see after that there's not a lot of protection against the virus, and at this stage this is our biggest threat.
Right. Okay. So, Eddie, there was a very interesting comment that was posted in response to my announcement of the webinar. The person was actually reflecting on a particular situation, I think, and was asking, what would the sector look like in South Africa if all the provinces approached compliance and enforcement the same way as Western Cape? So could you share your insights on the approach and best practices so others could possibly adopt some of these measures as well?
Thank you for that comment. We try our best here, but we're very, very lucky in this province. We got a stability in our leadership, and they support everything that we do. And they've also declared waste as a priority, both on a provincial level and also on local government level. So we're really, really fortunate in that. We share a lot, actually. We got governance structures in the province that we share in the province, like a Western Cape Recycling Action Group, an Industry Waste Forum, and then a Waste Officers Forum. And then we also link nationally with working groups, and we share what we do there. Just before, during this time now, the other provinces would have come down for basically a roadshow to look at practical things that we've started in the Western Cape. As I said, it's a little bit easier for us because we got the necessary resources, we got the necessary skilled staff to do it, and we got a lot of support from the politicians in this province. So we try to share because we're part of this country, and I'm very proud to be part of this country. And we shared, and we also learned from, because it's not just good things that happen in the Western Cape. I can assure you, there's a lot of my colleagues, provincial colleagues in the country, that's also doing great work, and that we start sharing that work. But if you see, we moved a little bit faster with things like waste to energy and beneficiation of waste, and we've done that because we had a threat of running out of landfill airspace, and we have followed a regional approach. And in this regional approach, suddenly there's a big pull and push factors, and that does help us quite a long to look at regionalization of waste management services, where we start looking at also how minimizing waste, valorizing waste, and using waste to energy. And I think we were a guinea pig for the country, and we're always prepared to share that. And as I said, there would have been a tour right now from the provincial colleagues, and that they would share with the other provinces. But also good things is happening there.
Right, thank you. So one person would like to know, what about chemical sterilization of waste prior to disposal as a solution?
I think that's not a problem. If you look at what Iswa say, as I said, I always, before I do anything, I'll check around the world, and I've got colleagues around the world that I'm fortunate to meet during my professional career. But I always check with Iswa, and that they were saying it's easy to actually kill the virus. So that will also work. We got actually an ozone plant also that it was established, but because of cost factors and a little bit, they need a bit of investment, they're not up and running now. But I think that will also help. You see, if by sitting, say, for 5 days and the sun is killing it, you can see it is not very difficult to kill the virus. So that will also help. But just remember that waste management is a system. So it's no use in just looking at the treatment facility. You must also look at the whole sort of, how can I say, life cycle, in the sense that you must look at how is it generated, how is it collected and transported, and if you use transfer station, how it's being done that. So it's very important that you got that infrastructure also in place, and not just focusing on a single of a treatment facility. That's very important to have the other aspects also in the system in place.
Okay, there's a question here which says, like, most informal settlements that did not have proper waste management systems and waste transfer stations. So putting plastic bags in the sun for 5 days is not so practical. So would there be any other alternative to this? And how much of the infectious waste is being segregated?
Yeah. As I said, at this stage, it depends on what type of system they use in informal settlements, because they got different systems depending on the size of this. So in the cases where they use skips, you can actually have an additional skip and have it in there. They can do it like that. In other cases, they in the more rural areas, they do have bins, and you can actually use it like that. We were fortunate to have very, very good and high functioning most of the municipalities in the Western Cape.
There's a comment here, and it says it will be interesting to see if the lockdown has a positive impact on some areas of waste management. For example, will we see a reduction in food waste disposal, a reduction on the litter that's on the beach, with less of the on-the-go consumption. It will be great if Western Cape can publish after this what the impacts, whether it's positive or negative, were on COVID-19 on waste generation, quantities and types, as well as litter.
We will try that, and this will be a nice exercise to go with. At this stage, our heads are down. We got a waste information system, and that we call IPIS, Integrated Pollutant and Waste Information. We got more than about 6,000 generators of waste, of holders of waste, that they're reporting to the system. At this stage, they report monthly. We ask them now that they can do it maybe, say, every second month, and we will reflect on that. I can't say that all the things that's wrong in waste management will change after this pandemic. It would be fantastic if that could be the silver bullet. But we'll try very hard. We in the Western Cape made a decision that we must also look at plastics. I don't want to steer it there. And we're also busy with the intervention now on plastics, where we specifically look at the multi-pronged approach, where we're looking at doing a regular impact assessment, where we look at service delivery, because we in South Africa has got a higher recycling rate of plastics than Europe. But unfortunately, what happened is that in Europe, it goes into a system, and it's either being incinerated or in South Africa, if it's not that the stuff that's not recycled is actually going to landfill or illegally dumped. So we done a project in the previous financial year actually on looking at the different models of service delivery in our informal settlements, and we learned quite a lot from them. And we've started seeing that suddenly we're much more cleverer, not because we're so clever, but because we start listening to the communities. And we see that co-planning is actually the way to go. So we're busy with an effort like that. We would also start with a heightened law enforcement, because we're very strict in the Western Cape. So if you don't play ball with us, even if you in the private sector or municipalities, we take you on. We're not prepared to afraid you to throw you in jail. So we work very hard on that, but we'll definitely try to see it, because we have to reflect on this. I hope we're not in my lifetime of my professional career we got another event like this, but we've learned a lot from disaster events. We had a big fire in the Knysna area. We also had the bird flu event, and during these events we've learned quite a lot to see what must be activated, what structures should be there, and how should we go ahead and deal with things like that. But we will try to write it up at this stage once we stem the tide of this pandemic.
Right. Lance, I think, is talking about Eastern Cape, where he says they have dilapidated landfills or poorly run municipal landfills. So what happens to the waste there?
Unfortunately, I don't want to tell you at this stage. Or as I said, I don't have first-hand knowledge for that. So I know that compliance with landfills in the country in general is not very good, also in the Western Cape. But we will not send the healthcare risk waste part of it, as I said, of untreated healthcare risk waste to landfills, as I say, to the general landfills. We will send it only if we run out of treatment capacity in the Western Cape to the high hazardous waste facility that we have, or then to the facilities that's well run. We got a very, very good system on how we monitor compliance. We got internal and external audits. So we got 4 internal audits and 1 external audit, and we also do departmental audits. So we can tell you on each landfill site where are they going, and we try to work very hard. I think we've taken on legally but 4 municipal managers at this stage. But unfortunately, I don't want to say anything what's happening in the other province. I think they should speak for themselves. But I assure you that they also got competent staff and they start looking at it. But yeah, we should improve landfill management in the country as a whole, and this is a general statement.
Right. On the plastics, actually, I wanted to ask this question as well. Mark is asking as to, the high plastic recycling rate is generally due to waste pickers, and it would be interesting to see how this rate is affected by waste pickers not working at present. So would this make a difference? Yes.
Yeah, no, that will be a big that I think that's hitting it on the button. As I said, it's if I look at reports that was brought out in South Africa in general, as I said, between 60 and 80,000 waste pickers, and they are in the other province. They are responsible for the lion's share of the recycling. But in the Western Cape, that's not the case. In the Western Cape, we got about 86% of the municipalities in the Western Cape has got some sort of separation at source. They don't do it in all the communities, but we got a 29% waste diversion rate in the Western Cape, and we're working very hard. In the next 3 years, we want to take it up to 50%, and we're focusing specifically on the biggest waste types like organic waste. We got about 40% of our waste is organic waste, and we set strict diversion targets for it. A landfill ban in 10 and a 50% reduction in 5 years. We also work very on construction and demolition waste, and we try to do this, but it will have an impact. We'll see that, and I think the impact will be bigger in the other provinces where they rely more on the waste pickers to get it to recycle the plastics.
Thank you. So as Anita here has commented, sharing knowledge is very important, of course, and she would like to know if you're working with other municipalities globally to set and support standards that can change because of the challenges discovered from this pandemic and any other better approaches.
We're fortunate, as I said, in the Western Cape, that our political leadership is forward-thinking, and they're not trying to send us around the world. So we had good working relationships with the northern part in Italy, where the eye of the infection actually are. We learned quite a lot actually from the way how they do their governance, because this is very important. We also got a very good relationship with Germany, and once a year they either come here or we go there, actually with Bavaria. And then also with the United States, we worked on a lot of cases. Actually, they helped us actually when we started with integrated waste management planning about 10 years ago. And we tried to interact through conferences and then learn from other countries also. The fortunate thing that in the Western Cape, we got a very good system of dealing with healthcare risk waste. And I think we've already, for the last 10 or 11 years, we got very, very strict legislation, and we got a manifest system in which we handle. So that's why it's easier for us to handle it, and we're fortunate to have enough capacity, which is can be different maybe in some of the other provinces. But we're very keen to work with us. So if there's other municipalities that's now part of this webinar and you want to make contact and we can share, by all means, we would love that. I think every day you learn. As I said, you mentioned how long I am in this industry, but there was not one day that I didn't love. I normally start when I do a presentation, I say, let's talk rubbish. Rubbish is my bread and butter, and I feel very passionate about it. So if we can liaise or make contact with any municipality around the world, please do. We would love that.
Right. So one of the Shubham, I think would like to know what action should be taken to protect oneself from the current municipal solid waste dump sites.
Can you just repeat it? I did the first part. I didn't get it. I'm
what
sorry.
Action? What action should be taken to protect ourselves from the current municipal solid waste dump sites? I guess she's referring to some dump sites in some area.
Okay. Obviously, if you're in South Africa, we got very strong legislation, and and in most cases, you can say that you got local standing, and you don't even have to wait for the government to take a municipality on if you think that it's impacting on your health. You can do that. I think at this stage, we've seen that after our last national elections, that civic organizations become more vocal. They take us on, and that's very good because we work very well with them. And I think any person who's now start putting pressure on their local municipality or provincial department, I think we welcome that we can work in trying to improve waste management in general in South Africa. We're very fortunate to have a very, very good minister, international minister, in Mr. Barbara Creasy. And she's done a lot, actually. And we're busy with very, very exciting developments that can change the way that waste will manage in South Africa forever. And we really hope that we're going to push through on this. But as I said, if you're impacted on bad landfill practices, take it up with your municipality. If you're in South Africa, then go to the provincial, my provincial colleagues, the same like me, and we will definitely do something against it. So you don't have to take it. You're a taxpayer in that area. So make sure that you keep your municipality and your politicians who selected honest.
So actually, the situation presents an opportunity to raise the bar in waste management with regard particularly to household and medical waste. Would you agree with that?
Absolutely, absolutely. That's true. There's a next slide that I could have shared. I'll do that now. That coordination is very, very important actually in doing it. Maybe I must share that. No. I think we must use this. We in the Western Cape, we say we thrive on a crisis. We had a lot of crises. We also had a drought, and we basically running out of water. And we work together. And I think there's a best practice worldwide in the city of Cape Town, how quickly we can reduce the consumption. So our persons is really versatile, and we must use this crisis actually to improve it. I do agree with you. But very important is the coordination between authorities in this case. So what we've done is we set up a WhatsApp group between our waste managers, and that we can quickly share information. And if there's any challenge or best practice, we share it like that. Then we become now quite conversant in using online technology like MS Teams, and we use it to once a week meet with our waste managers throughout the province and then share if there's any challenges. We try to help out and even share personal protective equipment amongst them and make sure that everybody knows what is doing. And then we also got with the environmental health practitioners, we got a similar discussion weekly, and with the Department of Health. And we really pushing this coordination in districts between municipal waste managers, environmental health practitioners, and the joint district operation centers. And so this is very important. Another point that's very important, and I think we've mentioned it a couple of times, is our waste pickers or waste salvagers that's so badly affected. Remember, they have out of income, and they're quite poor. And they've really tried to also be declared as the essential service, but because of the infection risk, unfortunately, they were not successful. But then there was a good initiative from the different industry bodies and Minister Barbara Creasy, the National Environmental Minister, and they started using, there's a fund that was created by our president, they call Solidarity Fund. And we know that one of the companies, maybe I mustn't mention them, Coke has come on board and asked all the industry bodies, and they started to put together funds. And we had to send through all the names of the informal salvagers or pickers which we have. And if you got a South African ID and you got a cell phone number, then they started paying vouchers, or in other cases, they're starting with food parcels actually. Is a bit of a problem where the areas, we've got a lot of foreigners also involved in this industry, and we're trying to deal with this challenge actually. And sometimes the people have one phone between 4 or 5. So we're trying to work through that also, because it's very important that we don't want to lose the infrastructure in the informal waste salvages, because, as I said, they're crucial to our recovery of recyclables in the industry. And obviously, we have to reach out and help them during this period.
Right. There's a comment here. The person says, I must commend the WC like always, but what lessons will the national departments learn from this? And it's time that we move forward in cleaning up the landfills in South Africa. So, because we will see a lot or reclaimers being contaminated from open dumps. So your comments on that?
I agree. Luckily, during this time, if the lockdown is enforced, there's no reclaimers on dumps at this stage. They can't even move freely. If you move and you haven't got a reason, the police or the defense force would clamp down on you, and a lot of these things has happened. So luckily, in a sense, that's stopped. And if it's in isolated areas, I think it'll not be big. So at this stage, in the Western Cape, there is no waste reclaimers at waste disposal facilities. So we must definitely learn from that. Yeah.
Okay. So one more question here we have is: are there any waste to energy projects that are active now that recycling activities are suspended?
No,
because right now recycling is not happening. So
yes. No. What happened is that we licensed about 14 anaerobic digesters, and that's, as I said, that's from the normal waste. And if they had contracts in place, the private sector still continued to work. And a lot of these waste to energy projects, or they say anaerobic digestion is actually waste from energy, is still going on. We got another waste to energy project where they use tires in the cement kiln. That's obviously going on. And then we've also licensed 3 pyrolysis plants in the province, but they're in the process of being built. We have about 20 sizable composting facilities, and that's ongoing because there's still food waste now. And also they deal a lot with avatar waste, and that's still going because we need the meat and the food actually. So that's going on. So I think maybe they got a little less waste at this stage, but they're still continuing as far as I know.
Yeah. I think someone might have joined a little late because the person is talking again about this keeping the bag for 5 days in the sun, and would like to know if it's at households or the landfill, and especially considering the practical difficulties. Yes.
Yeah.
So if you can just repeat that.
No problem. No, if they, I can make the effort to come and listen to me. I'll make the effort in answering the person. Now, it depends on your system. What kind of system do you have? And as I said, this informal setting is a bit different. So you will have to look at your waste-specific system, how you have, and to see how you can safeguard that. And then let the risk assessment and common sense be your guideline. And it's sort of worldwide accepted that outside of a living host, that the novel coronavirus only survive for 72 hours. And that sentiment is also shared by the International Solid Waste Association, ISWA. And we use that as a guideline. So in the settings where you can have it at 5 days at the household of this COVID-19 positive cases, we try to do that, but we built in another step that before it's actually taken to landfill, we try to have it for another 5 days at transfer stations, and then we take it to there. So if you got one, say there's a lot of municipalities that got 1 or 2 cases at this stage. If you can isolate them, it's very easy to handle. But when you're in the city of Cape Town and you got, say, over 500 cases, it's a bit different. So it depends on the magnitude, the number of COVID cases that's involved, and obviously you always I think everybody in waste management is sensitive to cost, because you have to look at cost, you have to look at risk, and you can't put your whole system at risk. So that should be your guiding principles, and it must be user friendly. If it's not user friendly, people will not do it. So it must be easy, user friendly, and practical, and obviously look at how you address the risk, and then the cost factor is also very, very important. We've learned from Italy, from Contarino, what they've done something similar to us, but what they then do, their waste has been taken away, but then they incinerate all the residual waste. Now, we don't have that luxury in South Africa, and we can't afford that in South Africa. So that's why I decided on the way to handle it as we prescribe now.
Right. There are two questions here related to recyclables again. Now, one is if you might have the answer regarding the reduction or increase in the volume of recyclable recovered since Corona, and also the effect the recycling commodity business, such as paper, plastics, and metals. What's the impact?
Okay, yeah, we will see this now. Remember, at this stage, we're on day 21 of our lockdown. So we will see. We're going to be locked down until the 30th of April, and obviously, I think the pandemic is still continuing. I think the forecast is actually saying that the bulk of the infections will come in September. We got a waste information system. We will follow that, and we got regular check-in with the recycling industry and the Western Cape Recycling Group. We will also follow it there. So it will have an effect. Unfortunately, I can't tell you now figures, but we'll do that assessment once we've gone through the pandemic, and we'll also check in with our industry partners. What was very interesting, because of China saying no to plastics and paper, we were sitting with a big problem in what do we do. So we will start engaging with industry to find different alternative plans actually to deal with this. One nice thing now is that a lot of the material now that we didn't have a market can now be used to be repurposed into things like in masks and stuff like that. So what has happened now, although we had a problem because specifically the paper market was in trouble, now there was an outlet. I don't think it'll take care of all the stocks because there was stockpiling, but sometimes even in a pandemic, there's certain opportunities that do come along.
Right. Great. Thank you so much.
Great.
We have another comment related to whatever was there. If anyone has any specific questions, we have a couple of minutes. And then yeah, one of our attendees would like to know, would like your contact details, and later, I guess, to share your contact details with them.
Okay, can you share it with them, or is it easier?
Sure, we can do that later. Yes, sure.
But no problem if I share it with them. I would welcome anything and even critique that will help us. And if we can learn from you, that will also be great. We would love that.
Sure. So this has been a very insightful session, I believe. Big thanks to everyone who tuned in today, and we hope you enjoyed the conversation as well. Special thanks to our expert, Eddie Hanekom, for sharing valuable information and insights. Thank you so much, Eddie. Recorded version of this webinar will also be available after the event. Stay home, everyone. Keep your distance, keep washing your hands, and stay safe.
Thank you so much. Thank you to everybody who's turned in, and I hope you get some food for thought. And if you can share also your, how can I say, experience, once you got my detail, you're more than welcome. Thank you so much for that opportunity.
Thank you, Eddie. Thank you. Stay safe. Bye.
Thank you. Bye.